My daughter's name is Ruby Njeri. Our Ruby's treatment journey started last year, that is February 2022. It was an incidental diagnosis. May we did bone marrow aspirate, and she was diagnosed to have bone marrow failure, and we were referred to India. Dr. Gaurav Kharya and Apollo Hospital was recommended to us by the primary physician that was seeing Ruby in our country back in Kenya.
Today we've met a very pretty sweet girl by the name Ruby Njeri. Ruby came to us from Kenya. Actually, she was referred to as a case of aplastic anemia, but when we evaluated her thoroughly, we figured out that she's suffering from a condition which is called as Diamond-Blackfan Anemia.
It was an incidental diagnosis. Initially, she didn't have any symptoms. She just had vomiting and poor feeding,
where predominantly the red cells are not produced, but over a due course of time, it can affect the other cell lines also. So she had presentation which was more like aplastic anemia, where the entire bone marrow was not functioning, but the reason for that was Diamond-Blackfan anemia. Now, for any such condition where the bone marrow is not working properly, either it is not producing the red cells or white cells or platelets, the one and only curative solution is bone marrow transplant.
Further thorough tests were done which diagnosed Ruby to have specifically Diamond-Blackfan anemia, and we did the tests to find the perfect donor for Ruby.
This is a very rare condition, and we screened the family members, we screened the sibling, but unfortunately we could not find any HLA identical donor. So finally we sat across the table and explained them that this is the scenario and we can consider for a haploidentical, which is a partially matched family donor transplant, to which they agreed. So we did half mesh transplant in a different way, which is called as a T-cell depleted transplant. Ruby tolerated the transplant preparation, transplant conditioning pretty well. The post-transplant course was also uneventful.
And it has been successful. We have been here for the last 100 days, and we can say the treatment journey has gone on well. The bone marrow team is always on standby in case of any complications, and they are very skilled, and both with the science and the practice to deal with the stem cell patients.
She's doing extremely well, and we wish her all the very best in her future endeavors. Namaste.
So when we met Dr. Gaurav Kharya, we have found that he gives very individualized care to his patients. He deals with you on a personal level. He's able to cater to all your queries and all your concerns regarding your specific condition. So our experience at Apollo has been good. Right from the beginning, we were guided through the process of treatment at Apollo. IPL is very helpful in giving orientation on all the departments. So I would recommend Apollo Hospital because it is a good hospital with very experienced specialists and experts in the different departments that they have. I would also recommend Dr. Gaurav because he's a good doctor and he has a good touch with the children.